Urology is a surgical specialty of the urinary tract. We manage a lot of kidney disorders, bladder, prostate, and other male genital disorders. I'm Dr. Andrew Dreslin. I'm a urologist at Gifford. One disorder we see in men, particularly as we age, is prostate cancer. It often has no symptoms until it's very advanced, but it can be detected at early stages with screening methods. That's typically a blood test called a PSA. Overall, we recommend starting that once a year at the age of 55 until the age of 70. Prostate cancer, when identified early, is very treatable with different types of strategies, but it's hard to know how to manage something until you know it's there, so I encourage everyone, particularly men at the age of 55 to 70, to have their PSA screening. Issues that are often important to my male patients certainly include sexual health. Symptoms can be variable from difficulty achieving and sustaining erections, difficulty with libido or interest or drive. These can often lead to confrontations with relationships, anxieties, fears of performance. And it's important to know that there are things we can do about problems. And if there are concerns, it starts with an initial office evaluation, because generally I tell my patients in urology, there's always something that we can try. As far as treatments for male sexual disorders, it can range from oral medicines, including hormonal therapies. One thing that certainly is advertised heavily these days is testosterone supplementation. That's not for everyone. Again, it requires an initial evaluation, but certainly some of the sexual symptoms we see is testosterone related. And for the right patients, testosterone replacement can dramatically improve the quality of their life. Other therapies include treatments for erectile dysfunction, and that ranges from oral treatments to mechanical devices to injectable therapies. There's a range of options that we offer. It all starts with talking and letting someone know what's going on, and that leads to options. So I encourage anyone struggling with symptoms to reach out, because there are things we could talk about and things that we could do. Another concern is men's health is the increasing number of suicides we're seeing, not only in our state of Vermont, but also nationwide and worldwide. Currently, about 60 men globally die from suicide every hour, and Vermont last year reported their highest rate of suicide annually. If you're feeling low, if you're feeling depressed, if you have feelings of anger or harm for yourself or harm to others, don't hesitate to reach out. Conversation and talking and expressing your feelings not only helps you feel better, but it also makes the people around you aware. There are professionals and counselors available who can help, who will support you, and it's something that we all need to pay special attention to. Testicular cancer is very treatable when caught early. We encourage males, particularly younger men, to do monthly testicular examinations where they use the tip of their fingertips to roll through the testicle. It should be a very smooth contour, so if there was ever a change, such as a non-tender firmness, that's often something that should be evaluated further by a medical specialist. Suggest starting at the age of 16, and something that men should do throughout their lifetime. But certainly for our younger male patients, testicular cancer is something to be aware of. And if there is a change noted, don't hesitate to either reach out to your parents, reach out to a family physician. I know there's a reluctance to speak out when there's a concern. You could ultimately identify something that's very serious while it's still very treatable.